there. So Steve, if you'd come up, say a few words. Thank you.
Thanks, everybody. We're feel like I'm like the advertisement for what you need to get done. So what we do in our office, as people ask us, what are we doing and how are we differentiated within the wonderful UT system? We focus on integrated health innovation. That's who we are. That's the area we are driving. And we have a wonderful team. Our whole team is here. I'm the nominal director, but really I'm the chief supporter and cheerleader for this wonderful team that's Ruben and Martin, and the wonderful staff, which is Nicole and Chris and Keegan and our partners in development and teams. What do? We sponsor innovation programs, of which the TxHc Catalyst is one of them. We activate and recruit people in innovation training. That's a key part that we are doubling down. That means not just the products, but moving and helping all of the partners and the teams. It means using these teams as learning environments for more innovation for people. And then we're engaging in high value opportunities both within and externally. And we're open to any and all of these for partnerships. The TxHc Catalyst program is sort of the signature program. It's always answering the right problem, right solution. How do we have the go-to-market strategy? That's a long-standing legacy with some amazing numbers. The TxHc Catalyst is that key. Ruben and some others, Nishi is here, have been doing this for many years. That was only possible, and what makes it different is that we have 300 plus clinical and industry advisors, of which many of you are in the room. This works because we're focusing on major problems where we have the innovation and processes in place. Some of the kinds of internal partners, Ruben showed a number of them, but that leads to these kinds of numbers. Some of you have seen these 500 teams, about 1.2 million has led to some amazing output, which is a dramatic number of disclosures, over 60 million in follow-up funding companies created. What's really amazing is you can start thinking about this for how you can use this towards our build out. We have a $2.5 billion tertiary hospital being built just down the street here at the University of Texas in the Medical Center. There's a partner clinic tied to MD Anderson, University of Texas system partner for cancer care. And we're doing this under this umbrella that we're calling the Hospital of the Future. So this challenge, how do we do this? Because we're able to build right in the world of AI. So can this be an AI native system? We talked a little bit about this at the last Roundup, but what have we been doing? We've gone through in the 2024, we had AI in Health Challenge. You're gonna see the teams around the fall 2024 challenge areas. And we also, because of our developing a partnership with AbbVie, we have an industry sponsored challenge, okay? So these are areas that are ongoing. What I want to also talk about is where are we at for 2025. So our future includes smart and sustainable systems around smart systems, sustainable design. That's upcoming. So we're going to have challenges coming up, and we're hoping that the kinds of wonderful innovations you're seeing today will be catalyzed in those areas. Our fall guess is that we're going to go after autonomous care because of the opportunities that's going to be provided in that space. And one of the thematics that I'm thinking about a lot is intelligent medicine. And what does that mean? But I'm giving you sort of a what have we been doing and what are we coming up in the near future? Okay. So how do we measure impact? There's lots of other questions. I just want to talk about 4 different classes of follow-ups for these TxHc Catalyst teams that I want you to be thinking about. One is an example of a really interesting technology that is now being deployed for real-time blood pressure monitoring for preeclampsia, so critical time during pregnancy. That team now has a wonderful ARPA-H grant to really drive that in a very meaningful way, $2.7 million to really do that next round de-risking. For those who were here last time, Babson was actually taking your blood draw and giving you testing. And they started out early on, back when the Dell Medical School was very early, and it was really around how you can match make and build. And Babson's, you can go to your HAB here in town and get blood tests. That was started through the TxHc Catalyst program in the past. So that's another example. Tim Mercer has secured a sponsored research project in partnership with Gilead. And so that's an example of another outcome from one of these Texas Health Catalysts. And then the last one is sort of this area that's really interesting because of this longitudinal partnership with AbbVie, went from identifying the problem areas, identifying potential opportunities, to now you're going to see actual teams working on this area of post-stroke spasticity care, which is a major issue in our healthcare system. What do we have upcoming? A couple of quick things I want to be advertising. We are interested in really trying to address major issues. So we have something coming up we're calling Caffeinate and Innovate. We've done a few of these. The next one is around how we're going to use AI in medical education. It's a major issue. It's coming up in February 11th. We have top researchers in the room, and their hope, our outcome, is that we're going to have really cool teams to go at and submit and present at the second UT System AI Symposium in Healthcare. This is open to the public. The dates just got set, which is May 15th through 16th. It's going to be in Houston. But we're really trying to figure out how we can activate all of you in this major area, which is how AI is going to be transforming healthcare. So with that, the most important slide is connect to us. If you have interested in questions or processes, that 2D barcode should work. We have a very simple email address, and we're going to be here today with that. Thank you for coming. Excited to have you, and I'm going to be in the audience just like you, and really getting a chance to see these wonderful teams, both current and past teams, as they showcase this program that's been developed for the last decade here in Austin. So thank you.